Great, I think we've let enough people settle in. Thank you for joining us and welcome to our Chamber Chat event. For those I have not met, my name is Shakiba, Shayani, CEO at the Guelph Chamber of Commerce, and I'm so happy to see so many of you this morning. Before we begin, I'd like to remind everyone that we are recording today's session, and we will be posting the recording on our Guelph Chamber YouTube page. We will be recording in speaker view and posting the recording in that view, so you will only be seen if you are speaking. And although I personally prefer seeing all of your faces, if you'd prefer, please feel free to keep your cameras off. I'd also like to remind everyone to please keep yourself muted when you are not speaking. Today, we're focusing on the policies surrounding vaccinations in the workplace. To begin, I will be asking our panelists a series of questions, and if time allows, we will move to an open question and answer period with all of you. If you wish to ask a question during that time, please use the raise hand function and I will call on you. If your question does not get answered by the end of time today, please don't hesitate to contact my teammate Isabel at guelphchamber.com, and we will try and get answers to you as soon as we can. So now I'd like to introduce our panelists joining us today. We have Marlene Jantzi from the Control of Infectious Diseases Manager and Liaison Chief at Wellington-Dufferin-Guelph Public Health. We have Mark Ellis, Director of HR at the City of Guelph. And we have Eva Lane, Employment Lawyer at SV Law. Thank you to the three of you for joining us today. So in order to save or to cover as much content as possible, I'd like to jump right into our questions. And we're going to begin today with Marlene. Marlene, I'm wondering if you could let us know what data points or indicators we should be looking out for us to have a sense that we're going to be moving into a more normal arena of activities and more normal day-to-day living again.
Right. Yeah. So basically, you know, as we go through this pandemic and try to aim for that over 90% of people vaccinated, we have a fairly large pocket still of young kids who are still ineligible to be vaccinated. So it's going to continue for the next bit, at least until those young children become eligible, to be a combination of still maintaining public health measures, as well as the following things. So what the province looks for at this point in order to stay open or drop restrictions is that the eligible population is fully vaccinated with 2 doses at greater than 75% of the population for 14 days. So it takes that 14-day period to build immunity. Then we also look at a stable incident rate of less than 10 cases per 100,000 population for 21 days. And a reproductive rate of less than 1 for 14 days, and as well as a test positivity rate of less than 0.5 for 14 days. And then of course, there's also those other indicators such as our, you know, locally and provincially, as looking at the healthcare system, just being maintained as adequate, our ICU beds and all of that. So those pieces all together kind of complete that puzzle piece of for the decision makers when they look at opening or closing. And all of that data locally is posted on our website and kept up to date on our case counts pages. So you can look at those graphs and follow along with what we're currently seeing.
Excellent, thanks. And we'll send out that link to the indicator page following this session. Thanks for that, Marlene. Quickly, what is the ETA on perhaps being able to get our kids vaccinated?
That's a really great question too. So we flipped back and forth a little bit. I think earlier this year we were hoping for mid-fall, you know, somewhat October-ish, and then that dream went away for a while, and we were really moved to looking more at January, right after Christmas. And currently, with just the current picture of the you know, COVID spread in schools, and we know that the submissions to Health Canada are currently set to happen. So we're really at this point hoping that there's maybe a possibility we can get some of those kids vaccinated before Christmas. So our current plan is to hope for the best, plan for the earlier date, and if it does happen a little later, I think we'd be looking at, you know, January-ish. So it's a gray area and it depends still.
Okay, thanks for that. So can you tell me a little bit about what public health is doing locally to promote vaccinations to those who are hesitant? And if you could, maybe let employers know how they might be able to help address vaccine hesitancy.
Sure. So I'm not sure what you're seeing in your workplaces, but vaccine hesitancy is quite low locally in Guelph. We have a over 90%, so 91.4 with first doses, and a little over 86% fully vaccinated. And the region overall, 85% and 80% respectively. So that's amongst eligible 12 plus. That doesn't count the kids underneath. So you have that large pocket of kids who can actually still allow it to spread. But those numbers do continue to climb. So what we're doing is offering we have our main clinic sites as well as pop-ups throughout the region. So we're really focusing on pop-ups to make it really convenient for people who may be hesitant, not necessarily hesitant about the vaccine itself, but possibly just if it's not convenient, they don't want to get it. We continue to do, communicate via social media and different avenues through different partners with up-to-date information and science on vaccine safety. And then finally, the newest piece is we are supporting the province's proof of vaccination requirements at the local level. And that just, kind of rolled out yesterday. So we'll be providing resources to, of course, businesses, government organizations, and different facilities around those requirements as they become more and more clear.
Thanks, that's helpful. So speaking of which, and I know there is still a lack of clarity about the province's vaccine certificate and the rollout as of the 22nd, what should businesses plan or consider as the rollout begins?
Yeah, that's an excellent point. So I think one of the main things is that if anybody had a chance to look at the proving of identity, so you'll need to make sure you have plans in place to look at those vaccine receipts. So right now, currently up until I believe October 13th, it's pretty open. Somebody needs to ensure that the vaccines receipt that's offered by the patron actually belongs to them. So it's really just checking the photo ID and then the actual certificate. And there's a really great frequently asked question page that the ministry is posting and continues to update on what these requirements look like and the different pieces of paper that are actually acceptable, which it's pretty broad right now. They can bring their receipts that they got at a clinic when they attended. You might have those electronically in your email. You can go online and download the printed receipt through the ministry website with your health card, which puts it all on a nice one piece of paper with a watermark. And then they're looking at creating the QR code option for October. So that will be available so business can just scan it. I'm expecting a lot more information to come about, how to actually look at this, record it. At this point, it sounds a little onerous. It's a little bit tough to check, but I do think there will be a learning and growing period with this that we'll be able to figure these pieces out and it will become more standardized.
Excellent. Thanks so much for that, Marlene. And I will say to the listeners and our community that they can also look to the Guelph Chamber website, where we often consolidate those kinds of details in one place. So we have all sorts of COVID-19 business supports listed and outlined, and we have information about what the province has put out to date, and we'll continue to update that regarding the certificates. I want to also reiterate that as businesses are managing through the rollout and are facing challenges that they can't seem to get answers to, again, not to hesitate to reach out to the Guelph Chamber, because we will make sure to ask those questions up the chain, whether that's to public health, to the province, to get that sorted as soon as possible. Thank you, Marlene. Eva, I'm going to come to you next. So the question that we are asked a lot about is, can we require staff to be vaccinated at our workplace?
Thanks. So the answer I'm going to give is yes, but since I am a lawyer, that obviously comes with caveats and exemptions and various types of it depends. But for the most part, yes, especially if you're operating a non-unionized workplace, the power of the employer to require employees to be vaccinated is pretty broad. Now, that being said, it's important to remember that requiring somebody to get a vaccine is in essence requiring them to undergo a medical procedure, right? It's something that penetrates the body. So we have to be very careful about privacy concerns. In that sense, it's really going to vary from workplace to workplace, whether or not you can actually justify that mandatory vaccination policy. So for example, on the one end of the spectrum, we have hospitals, long-term care homes, those sorts of congregate settings where you're dealing with vulnerable populations. It's pretty much a no-brainer that you're going to be able to require those employees to get vaccinated. On the other end of the spectrum, there are office environments like the one that I work in. You're still probably going to be able to justify it, but it's going to be a little bit harder because of course those employees can work from home. There's no requirement they be in the office. There's no requirement that they work directly with the public or with vulnerable populations. And I'm sure everybody is familiar with this. There are going to be certain exemptions as well. So human rights code exemptions, which would be primarily on the basis of religion or disability, those are going to apply in certain circumstances. Then the last thing I want to add is if you're going to do that, if you're going to require your employees to be vaccinated, you need to have a clear and robust policy in place so that they understand clearly the consequences, what's required of them. You can't just sort of lob that out there and assume that they're going to understand exactly what that means.
Thanks, Eva. So, we know that not everyone necessarily will be vaccinated. Can a workplace, an employer, require mandatory PCR or rapid testing for those who do not get vaccinated?
Yes, that is something that employers are doing. It is permitted. Again, it goes back to your policy and how you want to treat those employees that are choosing not to get vaccinated. In certain circumstances, we're seeing the consequences for not being vaccinated would be termination or discipline or a leave of absence. Other employers are choosing to use a variety of the other tools in the COVID-19 box, such as social distancing, PPE, remote work for those employees who are not able or not willing to be vaccinated. So yeah, rapid testing is another one of those tools.
So you're kind of getting to that a little bit, but if an employee refuses to be vaccinated or refuses to let their vaccination status be known to their employer, what are your rights as an employer, or what tips do you have for an employer to do if that's the case?
So for the most part, like I said, it's a broad power. So if you have an employee who's refusing to abide by the policy, and we'll set aside the human rights exemptions from this discussion for now. If you have an employee who's refusing to abide by the policy, termination is an option. You're not going to be able to justify a termination for cause, so without notice, but a termination without cause, assuming that the policy is clear about that being a consequence, that is something that an employer can do. And especially in circumstances where that employee might be compromising the health and safety of patients, customers, clients, or where it's inhibiting their ability to do the job, then that's going to be an appropriate consequence.
Okay, thanks. So tell me then, what does a proof of vaccination look like? What can an employer ask for, and how do they hold on to or not that information?
A couple good questions. Okay, so the proof of vaccination, it can look like whatever an employer feels is sufficient. So we have employers who are asking for, written attestation saying that that an employee is vaccinated or not. I'm typically encouraging employers to go a little bit further and request those dose receipts or some kind of proof from a physician or clinic where they got their shots. Because of course, while we like to trust our employees, there are going to be a couple of bad apples who swear that they're vaccinated when they're not. And then you get into the difficulty of trying to figure out whether anybody has not told the truth. So any of those is acceptable. I'm sorry, I've forgotten the second question now.
Well, I'm just wondering, how do we hold on to that information, or do we?
Yeah, so this is where the privacy factor comes in again. So you're going to want to have the minimum number of people in your organization hanging on to that information. So you usually have 1 or 2 people who have that information. It's secure, it's separate from anything else another employee can access. It's very important to keep that to the smallest circle possible. So only the people who need to know the status of employee vaccinations, they're the only ones who will know.
So are we allowed to hold on to the actual proof of vaccination, or just the note of whether or not they've disclosed?
Well, you're not going to keep an original. So if an employee shows you an original, you would take a copy and file it away, because you do want to have those on record in employee files just in case something happens. Given how prevalent Delta is, it's very likely that a lot of people will be in contact. And if it comes down to it, and you're looking at a lawsuit from an employee or an employee's family member saying that they've picked up COVID in your workplace, you want to be able to say, no, we have the proof. We did what we were supposed to do. We forced our employees to get vaccinated to the point that we could, and here's the proof. So you're going to want to have those records. Just like, I mean, I'm a lawyer. I tell you to paper everything, write everything down. So of course, I'm going to tell you to keep those records.
Yeah, that makes sense. And so speaking of records, can you tell us what would qualify someone for a medical exemption from the vaccine, or what it would look like for an employer to keep or look at proof for medical exemption? Yeah,
so the premise of that is, with the human rights exemptions, they're going to be narrow. So what I mentioned before was religion and disability. So disability is going to tie into your medical exemptions. There's no case law yet, I'm sure there will be, but there isn't yet, on what kinds of disabilities exempt you from a mandatory vaccination policy. So in other words, what is a legitimate medical ground not to get vaccinated? My understanding, and I'm speaking as, not a doctor, is that it would be something like allergy to vaccination components, certain heart defects, maybe you're immunocompromised. But it's a very narrow, it's very narrow. So there are very few people who can legitimately say that they have a medical exemption. So if you have an employee who's claiming that, it needs to be more than those frustrating medical notes that I'm sure we've all seen, where it's so-and-so is exempt from the vaccine. It's the equivalent of so-and-so needs to be absent from work for the foreseeable future. You need more information than that, and you're entitled to ask for more information, especially if you're in a workplace where, again, patient safety, customer safety, client safety is potentially on the line. So you would be looking for a medical note that sets out a little more detail. It is difficult because employers typically are not allowed to ask for diagnoses. So when employees request accommodations, you're allowed to ask for their needs. You're not allowed to ask for why they need those needs. But in this case, where they're claiming a medical exemption, you do need detailed documentation from a physician who has been treating them. So if you get a note from a walk-in clinic doctor and you can't tell whether that doctor has a relationship with this patient, you're going to need to ask more questions.
Okay, thanks. So if you don't mind, I might actually pop to Marlene again and ask, in her opinion, if she has any comments to make about what qualifies someone for medical exemption, and perhaps what employers should or shouldn't be looking for when they're provided a note about that.
Yeah, so I can speak to that. So my understanding is that the province is actually coming out with a standard form. It's just not been released yet, so that there will be something more scripted from physicians and nurse practitioners. But basically the window is really, really narrow. It is on our website under the physician advisories section of our COVID resources, if you want to actually take a look as to what our primary care providers have received, as to what they are able to classify, but you won't get many. It's really a true allergy. It's a diagnosis from an allergist. It has absolutely nothing to do with somebody's lack of interest in the vaccine or their belief system. So that's completely separate. So to be honest, you'll see like maybe one, if none, true medical exemptions. I know some organizations that have implemented this already have received a lot of different doctor's notes or whatever that are not according to the the province's very tiny window for those medical exemptions. If you need me to send you the list of what it consists of, I can. It is also posted. I can send you a link, but it's small. It's really a true allergy.
That would be helpful. And maybe, Marlene, I'll take a couple of the links we speak of that you might point to today, and we'll get that to those who've attended and get that out there. Thank you. I don't want to go down too far a different tangent, but it's related, Marlene. What about proof of exemption for mask wearing? Is that also just a slim of reasons why? And is there a standardized proof of that as well?
No, unfortunately, that one's pretty broad. It's never been narrowed. I think the hope for us was that the mask wearing piece would become more narrow, but I think it's just really hard to medically pin down because there's really no allergy to a mask. And how do you gauge someone's ability to, when they say I can't breathe in a mask, how do you actually measure that unless you send people for testing, which is again a huge drain on healthcare to do that. You can't do that properly. So the public health stance on that has been to really ensure that those who have mask exemptions or cannot tolerate a mask, because I really don't know that there's a true exemption for that they're not working in client-facing jobs, so that they have positions that are not client-facing, and that they're also not putting other staff at risk, right? So they can actually work if they're behind a barrier, but even that is, I mean, what are the chances? The chances are higher for your workplace. So it becomes a risk assessment within your workplace of where can this person work safely? Can they work safely in the workplace, or should they be strictly from home if they can't tolerate a mask? And again, I guess if you're looking at it from a patron perspective, it becomes really tricky too, because a lot of
Oh, sorry, Marlene, you were just muted there accidentally. So you were saying if you're in the patron perspective.
Yes. So was my answer too long? Is that why?
No, not at all. We just muted you by accident.
Yeah. So basically there isn't really a great way to have there's no way to have proof of that. So it comes down to whether your business is a policy that everybody wears a mask to be in there and you're excluding those. And I guess I can't speak to the human rights side of that. You have to get someone else to talk about that. But I can say that's where it really becomes tricky, and where we've probably seen the most pushback more than the employee side of things is that the patrons will come in and just say they have a mask exemption.
Perfect. Thanks. I'm actually going to use that to get back to Eva and ask her, what comments do you have to provide regarding employee or patron mask exemptions and the rights of an employer in how to address that?
Well, I probably can't speak to patrons. I mean, that's not the area I practice in. So you're asking if an employee refuses to wear a mask?
Right.
Okay. In that case, it's along the same lines. I mean, assuming that there's a clear mask policy, and in fact, I believe that that's mandated by public health in our area. So in that case, you're looking at disciplinary consequences for somebody who's refusing to take those steps. And quite frankly, masks are used as an alternative to the vaccine in some workplaces. And if an employee is willing to do neither, then you have a problem, because as an employer, your obligation is to provide a safe workplace for all your employees. And that obligation is paramount, and it will typically trump whatever reason the employee has to not wear a mask. As an employer, you are able to ask for more information from somebody who's refusing to wear a mask versus a business owner who has somebody walking in the door claiming that they're exempt.
Okay, that's fair. Thank you. And so one of my last questions for you, Eva, is can you ask somebody in a job interview if they have been vaccinated?
So again, answer is yes, but I would typically recommend that if you're wanting to ensure you're hiring people who are fully vaccinated, there are easier ways of doing it rather than just, throwing that question at somebody in an interview. First of all, you're going to want to have it in a job posting. So if you have a mandatory vaccination policy in place in your workplace, that should be clear from the job posting. If it's a job requirement, so for example, I have some clients whose employees travel to other sites and access to those sites requires vaccination. If it's a job requirement like that, you're going to want that in the job posting as well. So that gives you at least a warning to the employees or the applicants who are applying that this is going to be something that's required. The other way to do it is, instead of just saying, you know, are you vaccinated? You can say, we have a mandatory vaccination policy in place. Are you comfortable with that? Are you willing to comply with that? The other thing that sort of larger workplaces are doing is they will have an application form, and there's an opportunity to check a box, yes or no, with notes for exemptions if you are claiming an exemption under a human rights ground. So again, yes, you can, but be prepared for awkward follow-up if you just throw the question out there, and be prepared that an employee, or rather an applicant, may say no, or I'm not telling you, in which case you probably need to have a plan in place as to where the interview is going to go from there.
That's helpful, and those tips you've provided on how to better frame that question is great. Thanks, Eva. Okay, Mark, to you for a couple of questions. So we know that the City of Guelph recently implemented a vaccination mandate, and I'm hoping that you can take us through this process. You know, really curious about why the municipality decided to do this. And then, of course, just hear about how it went, what you've had to think through as you were creating the mandate, and if you have any tips for employers who are looking to do the same.
Certainly. So the genesis of the policy from our perspective really came from what's commonly known as Directive Number 6, or a directive from the province to all healthcare providers, specifically our paramedics, to have some kind of vaccination policy in place with regards to COVID-19. In reviewing that directive, we took it from a health and safety perspective and said, this really applies to all our staff, not just our paramedics, because as Eva and Marlene have said, it's about providing services, it's about interacting with the public and interacting with all our other employees. So we expanded it quite quickly to say, no, this is really a policy for everybody. In developing the policy, we had a lot of considerations, much like Eva's already pointed out today, is what is the scope, what is the breadth, and then what do we do after we've asked that question? Because it's not so much the asking of the question, that's pretty easy, but then what do you do after that? And then how do you ensure that an individual's human rights have been upheld throughout the process? So we took a very measured and moderate approach. Right now, and what I'm seeing out there are kind of 3 different versions of the policy. You have the extreme end, which is vaccination or job loss. That's kind of an all or nothing type policy that's out there, and some firms have it for various different reasons, which might be appropriate to their settings. And then you have the other side of the coin, which is no vaccination policy, I'm not going to ask. And then you have what I consider to be the moderate approaches, which is the one we took, whereby we're asking everybody to tell us what their vaccination status is, prove their vaccination status, and then from there, those who are unable to prove or unwilling to tell us, we start asking other questions. Why? Why not? And then we start looking at what can we do. So for those that aren't willing to prove the vaccination or go through the vaccination process, then we're looking at PCR testing for them. So to come into work, we'll administer regular PCR testing to ensure that they're COVID-free while they're in the workplace. This is for the protection of the public and for their co-workers. And then if they're not willing to do that, then they're unable to attend work unless their job is such that they don't have to attend the office. So again, taking it one step at a time with everybody. I can't comment on how the process has gone because we're still in that process. It is a lengthy process. One of the considerations we had is we're going to announce this policy, but really we're not going to take any direct action towards our employees until one full cycle of full vaccination has expired. So we put the policy out and we gave it want to say 8 weeks, which is enough time for an individual to get fully vaccinated. I might be off on that duration, and I do apologize. I don't have that number in my head. But we give it one full cycle of full vaccination, and then the policy really kicks in with the consequences of testing, et cetera, et cetera. The other consideration we had when we were looking at the policy is, while we have high vaccination rates in the city of Guelph within our region, we employ a lot of individuals from other regions. And as we saw in the earlier waves, it wasn't necessarily COVID coming or developing from within the region or within the city of Guelph. It was being brought in from cross-regional shopping, from cross-regional access to services, et cetera, et cetera. So we really felt this was a good way of protecting, putting the health and safety measure in protecting our employees and the public from that cross-regional bit. And really, the end goal is not to have a detrimental reaction to our employees in any way, shape, or form, but it's really to protect their health and safety.
That's helpful. Thank you for that overview, Mark. So I'm curious, can you tell us about any obstacles that's worthwhile letting us know about that are pertinent for other employers who are considering doing this work for their workplace? Anything you faced or any tips you have about how to not bump into those same challenges?
I can summarize all the obstacles in one. This is a very emotional topic for some. It's not necessarily a factual, I broke my arm, I can't work type situation. There's a lot of emotion behind it, some good and some not so good. And it's just entering into those conversations with an open mind, not with a predetermined conclusion, and say, okay, well, I understand your position is this. Now we require this to happen. How do we get from your position to this position? And really try to take the emotion out of it. It's not challenging the individual on their vaccination perspective. It's not challenging them on their views or what they believe is their rights. It's about properly implementing a workplace rule.
Thanks. It's definitely an emotionally charged discussion, and it is a smart flag to suggest that it's important to acknowledge that and to work with folks to manage that for sure. I have a couple of questions from what you've said, Mark. You mentioned PCR testing for those who are not disclosing their vaccination status. Do you receive rapid results for that? How does that work for employees? Are they done in advance of shifts?
Sorry, what I meant to say was anti-rapid. The
rapid test.
Yeah,
okay.
The PCR testing will validate the rapid test. So we are going to be doing rapid tests. Individuals will be coming to a city facility to take those rapid tests. And we're setting up a rapid testing program whereby if an individual is full-time, they'll have one expectation of rapid testing, whether it's twice that week or at some regular interval. And we're doing it based on job and worksite attendance requirement. If an individual is part-time or casual, we're going to do rapid antigen testing on a different schedule. And then again, if those tests are positive, they'll be held out of work until they've had the PCR test, which is the ultimate result that will follow.
Okay, yeah, thanks for that clarification. And then quickly, how is the city managing visitors or contractors, vendors? Do they have to adhere by the same policy?
So from an employer or a workplace perspective, we have the ability to implement a policy for our volunteers and contractors. So yes, anybody who is a volunteer or contractor has to go through COVID screening as per provincial protocols. And one of the questions on the COVID screening will now be, are you suitably vaccinated? If that's a negative answer, then they will be denied access to work on our site because of our workplace policy that we have in place. With respect to the public, though, we are following all provincial guidelines with regards to vaccination requirements. So the province did just announce the proof of vaccination to enter some businesses, to enter some locations, with a whole host of different exemptions associated with that. We're currently working through that, and its applicability to us. If it does apply to us, it might be a smaller subset of the services that we offer. So again, a lot more information and research is required on our part to understand how the vaccination status interfaces with the public.
Okay, thanks so much for sharing that insight with us, Mark. I appreciate that. Marlene, I'm just curious, before we open to some questions from the audience, what kind of guidance can you give us about, I think with September, we really think about that as back to school, with the last 18 months behind us, a feeling of back to work. Who should be going, quote unquote, back to work? What guidance do you have about those who can work from home to continue to do so?
Sure. So we are still really looking at the whole workplaces having an individual risk assessment in place. So I think you really need to look at what you're doing, who you're serving, how it can be done. I mean, there's obviously, because of our large group of under 12 still that can't be, are not eligible for vaccine. And then also back to what Mark Ellis just said about the fact that just because our area is well vaccinated in Guelph doesn't mean that you're not actually getting a lot of people from other areas. And just a note that we have posted our vaccine rates by municipality on our website now. So if you actually want to take a look at that, that might be helpful in those decisions too. So I guess you just need to really look at a few things. One, now is not the time to reduce what you're doing in the office if you're having people come in to the workplace or into the office to work, as far as masking, hand washing, that whole oh, we're all double vaxxed. It's not going to work for you if that's your office policy, where you think you're just all fine to go about business as usual. We're just not there yet. There's just way too much opportunity for COVID to spread in our unvaxxed population still, and then also impact. And in fact, even though that you're well protected from serious illness and disease, you're still going to spread it around your workplace, which makes things really complicated when somebody tests positive and they're fully vaxxed. And we still, as a province, haven't really figured out quite how to work with those asymptomatic positive tests and what they mean. So it becomes quite restrictive still. So really, I think you need to look at what do you have in place in your office to keep everybody safe. Do you want to have, is it working for people to work from home? Sure. So we're not at a place yet where we're just like, yeah, bring everybody back in and that's the best place for everybody. I think you really need to actually consider whether or not it's worth it. And what happens if you do get COVID positive cases in a almost fully vaxxed office space, because it is still going to impact you somewhat. Can you deal with that? Are you okay with that from a risk management perspective? I don't know what else to say there, but I do think it's a matter of keeping an eye on also our case counts, because since school has started, we'll say we've got a lot of schools with classes dismissed, and those cases are not because COVID was necessarily spreading in the schools the first week. It's because we've had COVID in these unimmunized populations over the summer that were not being caught with testing, because people weren't going for testing because nobody really had any reason to, because they weren't being barred from school if they had the runny nose or whatever. So we're seeing a lot more cases now. I think we'll know in another few weeks kind of how this levels off and what it looks like. But for right now, I don't think it is the time to necessarily pull the plug and say, let's just live life as normal.
Okay, thank you, Marlene. So I would like to open the floor to questions from the audience. As a reminder, if you would like to ask a question, please use the raise hand function that you see at the bottom of your screen, and then I will call on your name to unmute. Do keep in mind we are recording this meeting, so if you do not want to be seen on camera, just make sure your camera is off. But again, I'm happy to see your smiling faces if you'd like. I'll start. We did receive a question from a member in advance, and it's one we've heard a few times, especially by those in the service industry, retail industry. Julie's question was, as an employer who is going to have to or is being told that patrons are going to need to show proof of vaccination because she serves food. How do we manage the employee requirement to adhere by masks and shields, vaccinations, and that kind of thing? So there's, I feel like, a bit of a tension about the province requiring patrons to show proof of vaccine, but I think some employers are feeling like, but there's not the same amount of guidance or instruction for in the workplace. I'm curious if Marlene or Eva, do you have any comments to that at all?
I'm gonna let Eva take it, because the question is, it's not wrong. I mean, it's there. Things are definitely not perfect on this landscape, for sure, and something that we talk about. And I'm just gonna say, from a provincial perspective, we do give feedback on these pieces and hope that things get clarified as they come along. But that's really all I can say at this time.
That's fair, and we too are asking for that clarity. But so I'm curious, Eva, can you maybe even explain like what is so unclear about that right now?
Yeah, and this has been frustrating in legal circles as well, that the province has not provided the same guidance for employers as they are for business owners who are dealing with patrons. I know a lot of employer clients were waiting to see if that was going to come before they implemented policies, and it never came. So there is that disconnect between requiring people who come in the door to wear masks or, soon to be vaccinated, versus whether you're requiring those same things of your employees. It's not exactly a legal question, but it's really an assessment that each business has to make for itself, keeping in mind your duty to provide a safe workplace and sort of the feelings in the community about coming into businesses where they can't be sure that people are vaccinated. I know that varies widely from community to community, but I think in this region, the feeling is that the more fully vaccinated people you're surrounded by, the better. So really, it's an individual risk assessment for each business.
Oh, fair enough. Thank you, Eva. Okay, so I see a couple hands raised. We're going to go to Debbie, then Rob, and then our friends at Exodus Escape Room. So Debbie, I'll start with you.
I'm unmuted. Thank you. My question is regarding, if you're an essential service, are you allowed to ask clients if they're fully vaccinated for them to come on site to meet with you, or if you have to go to their location, if you're getting feedback from employees that are uncomfortable with meeting with unvaccinated clients?
I can take a stab at this one. So I hate to say this, but it depends. It always depends. It depends on the type of essential service you are, because right now the term essential service is pretty broad. And it also depends on what you're going to do. If a patron or a client says, no, I'm not vaccinated, then what the next steps are. It depends on why are you going to deny them access? Are you going to require that they stay outside while you provide whatever service it is you're providing? It's really a question of what comes next after you make that original inquiry. If it's something like healthcare, that's going to be a lot harder to justify excluding unvaccinated individuals, no matter what the basis is for their choice not to be vaccinated.
Sorry, quick follow-up. So if we're not healthcare and we are able to offer perhaps a virtual meeting instead, that would be sufficient?
Yeah, that would be sufficient, assuming that it's not compromising the service that you're offering. And again, without more information, it's hard for me to speculate. But as long as you feel like you can offer that same service in a safer way, so that your employees are still feeling safe, that's perfectly acceptable.
Great, thank you.
Thanks, Debbie. Thanks, Eva. By the way, Eva, Mark, and Marlene, if you feel like you need to jump in, don't hesitate to do so. Rob, to you.
Oh, thank you. So question, I was a bit surprised to hear, I think I heard this correctly, if there's a refusal to get vaccinated, that is not a cause for in lieu of time termination, if I got this correct.
Yes, so there's two types of termination: just cause and without cause.
Right.
So you're going to have difficulty terminating an employee for cause if they're refusing to be vaccinated. So you can
Wow.
terminate them without cause, in which case you would have to pay them their notice
Yeah.
entitlements. But if you're terminating them without notice, you're probably going to be looking at a lawsuit down the road.
Yeah, so that's significant, actually. Could there be like a suspension, if you will, while COVID's going on then, without pay?
Yep, that's something that employers are doing. So
Yes.
that the termination, that's really the extreme consequence.
Yeah.
There are a whole host of other options in between getting vaccinated and being terminated, like Mark spoke to. There's other ways of accommodating people. So leaves of absence would be one until COVID is over. I mean,
Yeah.
who knows how long that would be. But then there's requiring them to undergo frequent testing, load them up with PPE, separate them from their colleagues, be that at working from home or in some other area of the workplace. Those are all perfectly acceptable options between those two extremes.
Okay, thank you.
But just my interpretation of Eva's answer from a business perspective is absolutely right. If somebody says they're not going to get vaccinated, you can't immediately return and say, okay, well, you're terminated, because that will be a not for cause termination. If, however, you walk them through the policy and your progressive disciplinary process, you are increasing your likelihood of being able to establish that for cause type termination. If you are taking an employee-centric or a moderate type approach and looking for those accommodations and those other methods, if they continue to fail and you continue to move through your progressive disciplinary policy, you may be on a different playing field.
Yeah, and the other thing that I would just mention is a lot of one of the first steps that a lot of employers are taking with employees who refuse to be vaccinated is some education, because most of the time it's because they don't understand why the vaccine is important, how it works. They're just generally skeptical or have been reading the wrong articles on Facebook. And so the first step is really to help them understand why it's important and valuable.
Thanks, Eva. And I'm sure the resounding comment at the end of this is, of course, on a case-by-case basis, do get legal advice before proceeding. So thanks, though, for that. Okay, our friend at Exodus Escape Room.
Hi, my name's Tina.
Hi, Tina.
We have a custodian who does not want to be vaccinated. So we obviously deal with the general public. All of my staff who deals with customer service end of things are all fully vaccinated and very compliant. But my custodian does not wish to be vaccinated for personal reasons. Is it acceptable that I just get her to sign a waiver acknowledging that she has communicated that she does not wish to be vaccinated for personal reasons, that she's aware that we deal with the public, so that the building, which she is required to clean prior to her cleaning it, may not be completely safe, and that she will be required to wear a mask or maintain physical distancing if for some reason she comes in contact with any other employees. She works when the business is closed, so I don't think it's a safe thing. It's really them talking about us getting sued if she got sick by saying that she worked at a place that dealt with the public.
That's a tricky one. There's a couple of layers there. Tina, Eva, anything to start with there, or Marlene, anything about the science around transmission that you want to make a comment to?
I can jump in. I mean, given how specific this situation is, this is probably where you want to seek legal advice, because there's a whole host of considerations that go into recommending what you should do with this particular employee. If your only concern is that she might get sick and she might sue the business, then it's important to communicate to her what the risks are, have her acknowledge that. But if there is a risk that she could transmit to one of your patrons, then that's a whole other kettle of fish, and you're going to need to talk to somebody specifically about that.
Thank you, Marlene.
Yep, I could speak a little bit to the transmission risk. So if you have somebody who's in there cleaning and nobody is around and they're doing the cleaning, the actual transmission risk via fomites is really small. So I don't know that you could build a case on not having someone in there if they're, wearing a mask. Is this person masked? Some of those pieces around that. And are they doing their screening? Are they asymptomatic? If they're working while they're sick and they're actually coughing and sneezing on smooth surfaces, there's a small risk that, yeah, you could come along and do that. But then you're also going to have the ability for your clients to use hand sanitizer, wash their hands, promote good hygiene. So you'd have a bit of a tough, from a labeling that as a huge risk of disease when you're not actually directly around other people would be a little bit harder to do from a medical perspective.
But it would be okay to ask her to sign something saying we've had this conversation.
Well, that one I'm going to leave to the law perspective.
Yeah, I mean, quite frankly, if she were to get sick and sue you, a huge part of that lawsuit would be, well, why didn't you get the vaccine when you knew it was available? So I wouldn't say that that's a significant risk, that you're going to be somehow held liable for not forcing her to get the vaccine. That being said, this is all uncharted territory, and it is possible that an employer who has not put in place a mandatory vaccination policy could be held liable or could be considered negligent for not doing that, since that is the easiest way to have your workplace be as safe as possible.
Okay, thank you.
Great. Thank you for that question, and thank you for those answers. We have time maybe for one more question. I just want to open it again to the audience. Please feel free to use the raise hand function. When you click on reactions at the bottom of Zoom, you can do that. Any other last questions? Okay. Well, that means we got a lot covered. So thank you everybody for joining us today. Thank you to our panelists, Marlene, Eva, and Mark, for your insights, your feedback, and your experience. I hope the session answered some of the questions and helped make everyone feel a little bit more comfortable as businesses continue to transition back to their workplaces. As mentioned, this recording will be available on our YouTube page tomorrow. I thank everyone again. Please be in touch, stay well, and talk to you soon. Take care, everyone.